The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 In Focus.
Hello, I'm Susan Shapiro. Post-traumatic stress disorder, or PTSD, is a mental health disorder that some people develop after experiencing or witnessing a life-threatening event, like combat. The Department of Veterans Affairs estimates about 30% of Vietnam veterans have had PTSD in their lifetime. It's about 12% for Gulf War veterans and between 11 and 20% for those who served in Iraq or the War on Terrorism. Tonight, we'll talk with two veterans who have PTSD and how they are helping others heal. We're putting PTSD among veterans in focus. Joining me now is Rodney Thorne, an Army veteran who has PTSD and now helps other vets at Retreat Behavioral Health. Thanks so much for being here.
Thank you for the invite.
Can you tell me a little bit about your service and the kinds of things that you saw and experienced?
Yes, ma'am. I served in the service from 1986 to 1996. I was a Stinger gunner, Stinger team chief. I did 2 tours in combat, one Desert Storm, Desert Shield, and then I did a tour in Afghanistan as well. The thing about PTSD for me, it's always something that you can either have a flashback, a nightmare, night terror, some people call it, from simple things such as, a car accident, a loud sound, or fireworks. So it varies on how it can trigger your PTSD. And for me, I experienced a lot of combat-related injuries, seeing a lot of combat-related injuries as well. So for me, the main thing might be gunfire and fireworks,
Wow, just hearing fireworks. When you say it triggers things, so what happens then? What are you feeling? What are you seeing?
It triggers a moment where you might actually have like a flashback of being in the combat zone. It's a possibility it could be triggered by a simple smell of smoke. That sends you back into a mental flashback in your head, that you are back in that war zone or whatever.
That has to
So
be very.
different forms.
That has to be very frightening.
It can be. It can be. Now, due to trauma therapy and also a lot of PTSD classes and clinics, it gets better. Medication helps,
And yet you're not still in combat, but it is a feeling of really being there. Those of us who have not experienced that, that's what's amazing to me.
It can actually take you to a point where you feel like you're still in that particular area. It plays back the mental picture and all that. Yes, ma'am.
How were you diagnosed?
I was diagnosed through Veteran Affairs, the VA Medical Center.
This has been a long time for you. Is this something that is permanent, or can some people have it go away or be cured?
Well, I'll be honest, Susan, for me, it doesn't go away. It does get better, with treatment, with therapy, with medication. Sometimes they come few and far in between. The flashbacks or the night terrors, night sweats and things like that. So it does get better, but I don't think for anyone that's experienced PTSD, it ever goes away.
And that must be very difficult for anyone else you may be with when this happens.
Yes, it is. It was very difficult for my marriage at one point in time. Because the night terrors and night sweats, you often startle your loved one. It can vary, certain noises kids make and you just snap. And I don't mean snap physically, put your hands on. I'm just saying you just freeze up, yell, or whatever the case may be, because it startled you. And that's not fair to your family members, not fair to your loved ones. But yes, they do suffer the same, maybe not as extent as I do, but they suffer as well.
I imagine so.
Any family member involved with someone that has PTSD, you recognize it, and you often try to help them through that current situation, because it can vary. You know, sometimes it could be simple and short, and then it could be a moment, especially like July 4th, when it's continuous fireworks, where it's repetitive, you know, where you repetitive freeze up, or you just kind of, you just lay down, or whatever the case may be.
All right, well, coming up, we will talk more about the treatment, but coming up, we'll talk with another veteran who's helping vets deal with PTSD.
This is WGAL 8 In Focus, coverage you can count on.
Joining us now is Chris Spositi, the Corporate Director of Veteran Care at Retreat Behavioral Health. Thanks for being here.
Thanks for having me.
The numbers are pretty alarming. 30% of Vietnam veterans and about 12% of Gulf War vets who experience PTSD. Is it that we're better at diagnosing it, or that more vets are developing this?
I think the numbers are coming from an elevated awareness of PTSD. And I think there's been a lowering of the stigma surrounding PTSD as a society and as a culture that's helped more people come forward and talk about the symptoms that they're struggling with.
Why do you think there's such a stigma surrounding it, or has been?
From my experience when I was serving in the Army, there is a culture of not wanting to admit that you need help for anything, that you're strong enough to be able to handle anything on your own and still be okay. So I think that hits home for a lot of people and causes them to feel as if they can't come forward and say they need help whenever they're experiencing different symptoms of PTSD. Because they're afraid it's a sign of weakness.
I was just going to say it shows that they're weak, which obviously it really shows strength to come forward, I imagine.
Absolutely. Absolutely.
You mentioned symptoms. What are some of the symptoms of PTSD?
Hyper-awareness, hypervigilance, someone that's almost always on guard, a feeling of impending doom, depression, anxiety, sleeplessness. There are several symptoms.
That seems like it's so difficult to live with.
Yes, it is. It's very hard to live with.
So if someone's experiencing some of these symptoms, not just a vet, but someone else, what do you recommend?
I recommend reaching out for help, because it's been proven now that through therapy, these symptoms can decrease and you can heal. PTSD for a lot of people is something that they live with lifelong. However, it doesn't need to be severe for lifelong.
What causes it? Is it a mental illness? Is it just a temporary condition? Or what do you see as the cause of this?
It's a reaction to experiencing trauma. And that trauma can be anything. Some people experience PTSD from trauma that they had in their childhood. It can be from car accidents, or it can be from actually seeing combat or having some other traumatic experience while serving in the military.
Wow. So what has changed in terms of, you said some things have changed in how we recognize this and how we treat it. How do you see it as having changed?
Well, I think kind of as you pointed out earlier, that there's been a shift in the way that we view this, and it's not a sign of weakness by asking for help, but it's actually an extreme sign of courage, because you're stepping outside of your comfort zone and you're willing to search out for someone else who can come alongside you and walk through this journey with you, so that you're not doing it on your own.
In terms of treatment, what has proved to be effective?
There's a lot of different treatment models that have been effective. EMDR is one, CBT, DBT, all different therapeutic modules that deal with or are effective in dealing with PTSD.
All right, you threw around a lot of initials there. Let's go back to what was the first one you talked about?
EMDR.
What does that mean?
And that's eye movement desensitization or desensitization, reprogramming. I also mentioned DBT, dialectic behavioral therapy, or CBT, cognitive behavioral therapy.
So the first one, you talked about eye movement. How does that work?
So it's actually very interesting. It's through the movement of your eyes, and it accesses a part of your memory, and associates the traumatic event with the feelings of pain, with the feelings of distress. And through focusing on eye movements, you can desensitize an individual to the fear response to that event, that memory.
Interesting. Coming up on WGAL 8 in Focus, we'll continue our discussion and we'll look at the different types of treatments available.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Chris Spositi and Rodney Thorne, both with Retreat Behavioral Health. We've been talking about PTSD and how it affects veterans. And these are two veterans who have both experienced the disorder. Chris, you mentioned EMDR, psychotherapy that involves eye movement. Tell me a little bit about that, a little bit more.
What it does is it desensitizes somebody's emotional response to a traumatic event through focusing on a moving point as they are discussing the experience.
And from what I understand, it is a little bit controversial, isn't it?
It can be.
Bringing up those traumatic events for someone can be difficult.
It definitely can be. And we've seen that before through experience of where whenever first somebody starts EMDR, the emotions that they experience can be quite intense, and sometimes they can leave those sessions feeling very drained. However, as the treatment progresses and as they continue with the treatment, those emotions, the individuals start to see those emotions dissipate, and will become less severe.
Rodney, I know you said this therapy helped you. How so? And what was it like for you?
Like Chris described, it's basically, you're sitting there in front of a monitor with a light beam going back and forth, and you just kind of focus on the light. And then by doing so, you're actually talking about the event that caused you some type of traumatic event, whether it be from childhood, combat, or wherever it was from. And it tends, like he said, it tends to lessen the severity of it. The emotions, I wouldn't say the emotions you suppress, but the reaction is less tense. Once you get through it, like he said, that first day is, when you're talking about you're beginning the most traumatic event, normally by the time you're done with that session, your body is like done.
Wow. Chris, you said your symptoms were very severe when you came back from war, but have now lessened a bit. Is that the normal kind of thing that happens, or do some people, have very severe symptoms that continue?
Unfortunately, there are individuals that have severe symptoms that continue when they don't seek help. Through treatment, recovery is possible from PTSD, and is something that many individuals experience the same thing I did, where where those symptoms become much less severe, and daily living is something that you can do again.
How about you, Rodney? Do you feel like your symptoms are less severe?
Yes, definitely, definitely. Even due to trauma therapy, EMDR, DBT, any of those, it has lessened. You know, even with medication, the symptoms are very less emotional. The response is very, you know, it has lessened. Whereas like Chris was speaking of before, you seeing something jumping versus you seeing something just be like, oh, you know, now. But before, like he expressed when he came back from combat, yeah, you definitely see things, and it kind of started you, it started your loved ones as well.
I guess you never know when a noise is going to happen, so it's hard to predict how you're going to react, but I'm glad you're both doing better. We'll continue our conversation. We'll talk more about holistic treatments and how families can help others.
This is WGAL 8 In Focus, coverage you can count on.
We continue our conversation with Chris Spositi and Rodney Thorne, who are both with Retreat Behavioral Health. We've been talking about PTSD and how it affects veterans. Chris, I know there are a number of holistic treatments being used, like acupuncture. How well do they work, and what are you finding?
Holistic options are very effective as well. Acupuncture, yoga, music therapy, art therapy, equine therapy. And they work by teaching relaxation skills and by teaching the individual to be able to trust themselves again.
That's interesting. What is it about trusting yourself that goes into this?
Well, a lot of individuals experience, when they experience trauma, there's also a component that comes along with it of, I should have done something different. I should have reacted a different way. And it leads to a lot of self-doubt. So learning to be able to trust yourself again and realize that at that point in time, when you were in that situation, what you did was the best that you could do with where you were. It helps to be able to refocus and understand that that you can trust yourself again.
Is that something you've done, Rodney? Blamed yourself maybe for not being strong enough and not being able to deal with this?
Of course, yes. You definitely go through the blame, the guilt, you know, even addictions, you know. It's a very, very powerful diagnosis, you know, but it's also, like you say, it's achievable of healing. I don't know, I haven't got to a point of total healing, but it's definitely done. I mean, I've experienced the yoga experience, art, music, but yeah, it definitely is so.
What would you recommend to someone who may have a family member who has not yet sought treatment and may be resisting it? What would you both recommend? We'll start with Chris.
I would recommend just encouraging the family member to and sharing the perspective that reaching out for help isn't a sign of weakness, that reaching out for help is actually a sign of strength. And sharing with the family member that there's a certain amount of pain and suffering that they are going to go along with or experience as well, as a result of the other individual's PTSD. So, you know, having that open and honest conversation with them and encouraging to seek help and to reach out to someone, I think is very important.
And how about you, Rodney? What would you suggest?
I definitely agree with Chris 100% there. You know, you definitely have to reach out to the loved one, no matter what how hard you feel it might be, or how they might, you worry about how they might react. Sometimes we tend not to react the way as expected. You know, you might think I'm just going to be yelling and screaming. No, I'm not doing it. And sometimes it could be that's what I needed. I needed you to finally say, I need you to get help.
And Chris, there's obviously going to be future wars. Do you think there's any way to prevent this, to maybe train soldiers ahead of time so that they don't experience PTSD?
Well, that's a good question. And I don't know if there is a way to really prevent PTSD from happening. I think the more that we can do to prepare soldiers for what they're going to experience when they go into battle will definitely help. But I don't know if there's a way that we can ever prevent it.
And as you both have said, one never knows how they're going to react to seeing such horrific scenes.
Right.
Absolutely.
Well, I'm certainly glad to hear you're both doing better.
Glad to be.
Any last words for others?
Just really be strong. And if this is something that you're struggling with, know that you're not alone, and know that there is help. And all you got to do is take that first step.
And I agree with Chris there. Not just, when you take that first step, you could be the loved one of the person that's dealing with PTSD. But that, like I said earlier, it might be the only thing that can change it is them to hear you say, because they may be waiting to hear you say, I need you to get help.
The reinforcement and the support is important. Thank you both for being here and sharing your experiences.
Thank you very much.
Thank you for having us.
If you are a veteran in crisis or concerned about someone, here's a number to call: 1-800-273-8255. Just press 1. Thank you for joining us for WGAL 8 In Focus. For all of us at WGAL, I'm Susan Shapiro, and join us again next Saturday night at 7 o'clock for WGAL 8 In Focus, right after NBC Nightly News.